and welcome to the North Quincy High School Healthcare Technology Nursing Assistant Pinning Ceremony. We want to start by thanking all of our family and friends who are in attendance to acknowledge and celebrate all of the hard work we have put into this program in the past few years. This is not a typical class that high schoolers are exposed to. We have learned to lean on, encourage, support, and work together as a team to allow us to all be successful in this program. We began this journey 3 years ago as sophomores and have learned a tremendous amount that will be the foundation to our success as we move forward with our healthcare studies.
We are ready to move forward. Some of us may be working as CNAs, others as home health aides, and some focusing on our nursing, pre-med, and pharmacy studies. We as a class are ready to use our skills we have learned in this program to care for people, help people, and contribute to this amazing, rewarding profession. We take great pride in our achievements and eagerly anticipate the bright future that lies ahead for all of us.
A pinning ceremony is a symbolic welcoming of newly graduated or soon-to-be graduated nurses/nursing assistants into a nursing profession. According to Linda Kitchen, a pinning ceremony is a recognition from a nursing facility in acknowledgement on part of the students that the students' hearts they are ready for the role of a nurse or a nursing assistant. The Nora Bodway calling pinning ceremonies symbolic of initiation into the brotherhood and sisterhood of nurses, and remarked that they are often more personally meaningful than the graduation ceremony.
Historically, a nursing or nursing assistant pin symbolized an educated nurse or nursing assistant who was prepared to serve society as a healthcare professional. The history of nursing pins dates back to the Crusades in the 12th century. Monks initiated into the Knights Hospitalier that cared for injured and ill crusaders were given a Maltese cross, which is considered to be the first form of a badge given to represent the nursing profession. After the Crimean War, Queen Victoria awarded Florence Nightingale the Royal Red Cross for her service as a military nurse during the conflict. Nightingale later presented a somewhat similar Medal of Excellence to her outstanding nursing students. The Nightingale School of Nursing at London's St. Thomas Hospital created a badge featuring a Maltese cross that it awarded to nurses who completed their studies. The first pinning ceremony in the United States occurred at New York City's Bellevue Hospital in 1880. By 1916, pinning ceremonies for most, if not all nursing and nursing assistant programs became an established tradition in both the United Kingdom and the United States.
Of the hard work that your children, our students, have put into this program, if I wasn't an educator, I would have been a nurse. Not because I couldn't have been a doctor or didn't want to be a doctor, but I've had experiences with my own children, all of whom, 3 of them, ended up in the NICU. And though the doctors took great care of them, it was the nurses that really manage the patient, do the things that make you feel like you're okay and make you feel safe, and all the other things that go along with it. So I applaud you for the profession that you've chosen and the studies you've done here. I don't think there's a more rewarding or important job other than being a parent and maybe a teacher. I'm a little skewed, sorry, than being a nurse. And I hope you take the opportunity you had here and run with it when you get to college. I think most of you are. I do want to thank Ms. Norton and Ms. Fitzgerald for all of their hard work. Can you please give them a round of applause? And I'll turn it back over to them. Thank you.
Thank you, Mr. Gilbert. Thank you, everyone, for being here today. For those of you that do not know me, my name is Ms. Norton, and I would like to express my heartfelt gratitude for having your children over the past few years. During this time, I've truly enjoyed spending time with them as they have reached all their milestones and helping them prepare for their future. Saying goodbye to this class is going to be challenging, and they're going to be greatly missed. At this time, I'd like to provide you with a brief overview of the requirements your children needed to meet to successfully complete this program. In order for them to qualify for the state CNA examination, The students were required to maintain an 80% average in the health assistant program over all 3 years, and they needed to complete a minimum of 24 clinical hours in patient care. During their clinical rotation at Alliance Health at Marina Bay, our students perfected essential skills. They were able to provide care for their residents, helping them with feeding, helping them transfer in and out of bed, in and out of the bathroom, helping them getting dressed, helping them perform exercises, and performing their vital signs, which is a huge accomplishment for a high school student. After they finished all of their clinical skills at the rehab center, they came back here and completed their course classes. Throughout their clinical rotation at the Alliance Health in Marina Bay, they were also seen by the staff members as staff members, and all the patients that they cared for greatly appreciated everything that they did.
Once the students fulfilled the state requirements, they were required to pass a 2-part state exam. The first part consisted of a proctored knowledge exam, where they needed to recall all the content they learned over the past 3 years. The second part was the manual skills test, designed to assess their ability to perform nurse aid tasks approved by the Department of Public Health. Students had to learn and demonstrate 20 skills, with each skill comprising 10 to 30 steps. They were allotted a maximum time of 40 minutes to complete 3 to 4 skills. To pass the skills component of their competency evaluation, they needed to achieve a minimum score of 80% on each task, ensuring no key steps were missed. At this time, we would like to acknowledge our students' success and dedication to their patients, this program, and present them with certified nursing assistant pins. First up is Kiana Acevedo Rivera. Avery Carson. Samantha Chen. Samantha Dobb. Ava Farolito. Iris Joka. Annabella Glennon. Annie Hayes. Jessie Huang. Keelan Irwin. Aya Kafihi. Sophia Liu. Kai Lee. Shayna Nguyen. Serena Ticelli. Vienna Trom. Rui Yan. Steffi Zhao. Tiffany Zhang. And last but not least, Raymond Zhao.
We will now ask the CNAs to stand and light their candles.
Together we will recite the Nursing Assistant Pledge.
We promise to aid the sick, comfort the dying, and provide shelter to others' burdens whenever possible. To practice all that we have learned, to practice the best of our abilities, and to continue learning to benefit our charges. We hereby stand together as one to seek out all who are in need and forever support the fellow members of our team.
Today we are gathered here to celebrate and acknowledge all that we have accomplished and all that is to come. We stand here having received recognition for our hard work, officially a part of the nursing community. We want to congratulate all of our peers for a job well done. This ceremony is just the beginning. We hope we all continue on with whatever we have dreamed of.
Whether that's working as nursing assistants or home health aides, attending college, becoming nurses, physician assistants, doctors, radiologists, whatever it is we want to do, we have proven we belong here and in this profession, and I know we will do great things. We want to thank our family and friends for being here with us. Your unwavering support over the years has meant the world to us. Thank you for everything.
How about a nice round of applause once again for our esteemed healthcare technology teachers, Ms. Norton and Ms. Fitzgerald. Their commitment and dedication to our healthcare technology program and their advocacy for their students is second to none. We appreciate the leadership of Principal Gilbert, Assistant Principal Holland, as well as our Career Vocational Department Chair, Ms. Marianne Collins. We thank them for all they do every day. Future healthcare professionals, I want you to join me and take a moment and reflect on the amazing accomplishments that you have endured over your educational journey within the Quincy Public Schools. But first, how many began your educational journey in Quincy Public Schools beginning in kindergarten or first grade? Show of hands. Terrific. 4 years ago, you walked through the doors of North Quincy High School. Since then, you've taken full advantage of everything a comprehensive high school has to offer. College-bound academics, technical competence, extracurricular activities, and community service. You've accumulated numerous hours of hands-on and real-world experiences with your clinical placement at Alliance Health and Marina Bay. You've obtained an array of industry-specific credentials and certifications, including American Heart Association, infant, child, and adult CPR, AED, and first aid. You've obtained your CNA, your certified nurse assistant, your home health aide, OSHA and CareerSafe, the Dean Vaughn medical terminology, as well as your certificate of occupational proficiency in healthcare technology. You, your instructors, and your family should be very proud. As Executive Director, I certainly am. Your years in Quincy Public Schools has prepared you well, all due in part to the exceptional teachers and educators K through 12 that assisted, guided, and supported you along this educational pathway. In the fall, you'll take on your next challenge, whether you continue onto post-secondary education or directly to the workforce. Remember one thing. Remember your roots. Remember where you began, here in Quincy. My mother not only successfully raised 6 boys along with my dad, but her dedication to the nursing profession was extraordinary. My mom was a registered nurse for over 30 years who was committed to the health and well-being of serving individuals, families, and the community. In the years ahead, as you serve as healthcare professionals in public, nonprofit, or private sector, continue to be caring, compassionate, and kind to your clientele, whomever they may be. We wish you the best of luck always, and thank you.